Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen.
We left off with a question. Excuse me. What about sensory processing, nonverbal autism ID and ADHD unattentive? Any suggestions?
Yeah. So I'll talk about that while you
And maybe
have a drink.
Mute my microphone.
So, all of these are a little bit different from each other and also have some similarities. So we're talking about ID, which is intellectual disability, which in the old days used to be called mental retardation, which essentially is just a kind of man-made measure of our intelligence, which again has to do with how we imitate from the environment and how we learn. Autism, which of course is its own thing and is a huge spectrum and has multiple different areas of that are affected. And then we're talking about ADHD, attention deficit hyperactivity disorder, and very specifically we're talking about the inattentive type. Because with ADHD, you also can have, other types of that are hyperactive type, which is also its own thing. And you can also have ADHD combined, which is inattentive and hyperactive. And so, it's difficult sometimes to differentiate between inattentive form of ADHD and autism. And in the past, it used to not be allowed to actually diagnose both of those things at the same time. But it is now allowed to diagnose those. And, the way I think it's important to look at the very specific diagnostic criteria for each one. When I look at a child who has just ADHD, even if it's inattentive type, hyperactive type is easier because you have a child who's literally climbing the walls and running around and extremely hyperactive. But when you're looking at inattentive type, the difference is that it's actually interesting. Thank you for raising it today, because I think the difference in inattentive ADHD as opposed to autism has something to do with the sensory input. And I'll talk about that a little bit, because I think children who have ADHD and attentive are kind of, their language ability is pretty average. Their ability to, if you sit them down and instruct them to, take a look at your eyes, your nose, your mouth, your whatever, they are kind of able to do it. It's just very difficult for them to do it because they get distracted by other stimuli, right? Whereas children with ASD, what you're seeing in the lack of attention is a little bit different. It's almost like they start out with a much more severe inability to pay attention and focus. And sometimes to me, it appears like they just don't have the sensory ability to do that. A lot of our kids on the spectrum have a hard time focusing, let's say, on your eyes, like just look at me. And no matter how hard they try, they can't. They're looking at the air in front of you. They're not able to focus both of their eyes, it's called binocularity, on your face. They will have issues and they'll be fleeting eye contact. And that's not the same as what you see with a child who just has ADHD. It's a little bit, it's quite different actually. A child with ADHD has a lot of other skills are intact. Their only issue is just being distracted. And the main thing with a child with ASD is that their other skills are not intact. They have a really hard time paying attention because they're not understanding language. Multiple sensory things in the environment will affect their ability to pay attention. And it's I think, in my opinion, it's a more severe disability in that sense.
Don't forget, you can watch Ask Dr. Doreen live every Tuesday morning at 10 a.m. Pacific time. We hope to see you there.